Hey everyone, and welcome to today's Explainer. Today we are diving into what I like to call a massive global detective story. It's the case of the missing pills. You see, every single day, millions of prescriptions are written by doctors, yet a genuinely mind-blowing number of those treatments just vanish into thin air. Well, actually, scratch that. They don't vanish. They just disappear into the backs of our medicine cabinets, never to be taken. So today, we're unlocking the mystery of medical non-adherence and digging into the incredibly fascinating psychology of why we do this.
But before we get into the hard data, I want you to ask yourself a question and be completely honest here. Have you ever ignored a doctor's advice? Seriously, think about it. Maybe you skipped a dose just because you were feeling a bit better, or maybe you completely forgot to pick up an antibiotic from the pharmacy. If you are nodding your head right now, do not worry. You are absolutely not alone. And honestly, understanding why we do this reveals a whole lot about human behavior. To put this into perspective, according to a 2003 review carried out by the World Health Organization, the rate of non-adherence to medication in developed countries ranges anywhere from 10% all the way up to a staggering 92%. And here is the kicker. They found that roughly half of this non-adherence is actually totally intentional. Plus, it's way more likely to happen with chronic, long-term conditions rather than your acute, short-term ones. We're talking about a massive crisis hiding right in plain sight.
Okay, so let's set our baseline so we know exactly what we're investigating today. The World Health Organization defines adherence as the degree to which a person's behavior corresponds with the agreed recommendations from a healthcare provider. I want you to notice that word agreed. It implies a partnership, right? When that partnership breaks down, that is when we get non-adherence. And that essentially just means failing to follow treatments or totally bailing on appointments. So, moving to Section 1, the medical adherence crisis. More than just missed doses.
When this medical partnership fails, the stakes get incredibly high. Just to illustrate the sheer scale of this problem, let's look at the financial toll. Research from the Doctor-Patient Partnership and the Institute of Healthcare Management in the UK looked at the year 2000. In that single year, 17 million general practitioner appointments and 5.5 million practice nurse appointments were completely missed. The estimated cost of that? A whopping £150 million. That is a massive economic drain from missed appointments alone.
And obviously, it doesn't stop with money. Non-adherence triggers this dangerous domino effect. First, you have a huge waste of medication, which messes with supply and demand. But then, the real-world consequences hit. The illness naturally progresses, and that leads directly to an increased use of medical resources, meaning the patient might need hospital visits or way stronger, more aggressive treatments down the line. Ultimately, this all cascades into reduced functional abilities and a significantly lower quality of life. It's a total system failure. All right, Section 2, why we ignore doctors. The motives behind the mystery. Let's dive into this.
If the consequences are so clearly terrible, why in the world do we do it? Well, treatment failure usually happens right out of the gate in two distinct ways. On one side, you have primary non-adherence. That's when the doctor writes a prescription, but the patient never even bothers to collect it from the pharmacy. On the other side is non-persistence. This is when a patient actually starts taking the medication, but then just stops early. Now, this one is usually unintentional. It happens because of miscommunication, simple forgetfulness, or maybe just having a hard time getting the medication.
But what happens when skipping your meds is completely intentional? Well, a fascinating study from 2012 by Laba and colleagues looked into something called rational non-adherence. They surveyed Australian participants and discovered that patients aren't just being lazy or difficult. They are actually making deliberate, calculated trade-offs. People are mentally weighing factors like the monthly cost of the drug and the risk of current and future side effects against the actual benefits. If the math just doesn't add up for them, they consciously decide to adjust or completely stop taking their medication.
And this brings up a brilliant psychological framework known as the health belief model. Think of it like a complex internal checklist our brains run through in a split second. Imagine your doctor just handed you a new prescription. Subconsciously, your brain asks, okay, how bad is this illness really? That's perceived severity. Then, am I personally at risk? Perceived susceptibility. You weigh the perceived benefits, like, actually feeling better, against the perceived barriers, like how inconvenient or expensive the drug is. You might need a cue to action, like your partner nagging you to take it. And finally, self-efficacy. Do you actually have the confidence to stick with this daily plan? If your brain leaves even one of those boxes unchecked, that pill is staying right in the bottle.
Which leads us to Section 3, measuring patient honesty. The interrogation, versus the wiretap.
So if the psychology of taking a pill is this complex, how do doctors even know if you're taking your medicine? Well, the easiest way is just to ask. They use subjective measures like the Medical Adherence Measure, or MAM. Basically, it's a clinical interview relying entirely on the patient's word. But there's a glaring weakness here. We can call it the illusion of truth. Let's be real. Patients lie. Because of embarrassment, guilt, or just not wanting to get lectured, self-reported data is terribly unreliable. In fact, an older study by Rickert and Drotar looking at adolescents with diabetes found that the kids who flat out refused to participate in an adherence study were the ones most likely to have terrible adherence to begin with. So to get around that pesky little problem of human honesty, researchers use objective measures. Think of simple medical dispensers with those little days of the week on them. Doctors can also do something called pill counting, where they literally ask you to bring your bottle in and they count what's left. But I'm sure you can spot the massive flaw here, right? Just because a pill is missing from the bottle absolutely does not prove the patient actually swallowed it. It is so easy for someone to just dump the pills in the trash to fake their adhering.
And that brings us to an absolutely brilliant solution. Enter the TrackCap. This was utilized in an amazing year 2000 study by Chung and Naya. The TrackCap is a medication event monitoring system, or MEMS. To the patient, it looks exactly like a normal pill bottle cap, but internally, it essentially acts like a secret wiretap. There's a hidden microchip inside that logs the exact time and date every single time that cap is twisted off and put back on. It's literally a technological trap, and here is how it works. Step 1, the patient opens the bottle. Step 2, the TrackCap secretly logs that exact timestamp. Step 3, hidden adherence patterns are completely exposed. In the Chung and Naya study, they tracked asthma patients, and this device revealed the raw truth. Overall compliance was actually pretty solid, but the TrackCap caught 2 specific patients recording multiple opening events right before their clinic visits. They were literally dumping out their tablets in a panic just to fake their compliance. Busted. Okay, moving to Section 4, fixing the adherence gap, toys, prompts, and cash. So we know it's a huge problem, and we know people lie about it. How do we actually fix it? Well, one brilliant strategy is customizing treatments to actually fit a patient's lifestyle. Take young children with asthma, for example. The standard clinical spacer device they have to use, it looks super medical, it's really intimidating, and it constantly causes toddlers to stress out and scream. But then there's the funhaler. Medically, it does the exact same thing, but it has a built-in whistle and a spinning toy that only activate when the child breathes in correctly. The results of a 2004 study by Chaney and colleagues comparing these 2 devices were just incredible. With the standard spacer, only 59% of children had been medicated the previous day. But when they switched to the funhaler, that number jumps to a massive 81%. Even better, 73% of the kids actually achieved the recommended breath cycles with the funhaler, compared to only 50% with the standard one. Literally just by slapping a whistle and a spinning toy onto the medicine, they completely changed the attitude and the adherence of both the kids and their exhausted parents. Now, customizing a device is fantastic for an individual, but what if we need to fix adherence on a massive citywide scale? That brings us to community interventions. There's a landmark 1984 study by Yokley and Glenwick that tackled how to increase preschool immunizations across an entire community. At the time, kids who weren't immunized faced severe risks, like literally being banned from attending school. So the researchers wanted to test a bunch of different methods to motivate parents, starting with just simple mailed reminders, all the way up to handing out hard cash. They tested a few specific conditions against control groups. First, a general prompt. Next, a highly specific prompt that actually named the child and exactly which shots they needed. Then, that same specific prompt combined with extended clinic hours for convenience. And finally, a specific prompt combined with a monetary incentive, specifically a cash lottery. And as they tracked this over several weeks, the condition with the monetary incentive absolutely rocketed past all the other methods. That monetary incentive produced a massive 29% increase in the number of immunizations given. The specific prompt, paired with the chance to win a cash prize, just blew the other options out of the water in terms of immediate impact. Now, the researchers did note it was technically the least cost-effective method over the long haul, but it proved undeniably that targeted communication plus a financial reward is an incredibly powerful behavioral tool to drive medical adherence in a whole community. Money talks, right? Which leaves us with a fascinating final thought for today.
if your doctor actually paid you to take your medicine, would you finally follow the prescription perfectly? Or, as we've seen with the whole rational non-adherence concept and that complex internal checklist of the health belief model, is the psychology of adherence just way more complicated than a simple cash reward? From secret wiretaps on pill bottles to spinning asthma toys, understanding human behavior is clearly just as critical as the medicine itself. Thanks so much for joining me on this explainer, and keep questioning what's behind the data.